In this video, we are going to discuss about the anatomy of parotid gland. We will discuss the features, capsule of the parotid gland, the external features, the relations of the gland, the surfaces, borders, and the structures within the parotid, the blood supply, nerve supply, lymphatic drainage, and at last we will discuss about the parotid duct. So first we will start with the features of the parotid gland. So while discussing the features of the parotid gland, first I want to tell you the meaning of parotid. So in parotid, para means around and otic means ear. So it means around the ear, that is, it is related to the ear. Okay. So, and one peculiar feature of this parotid gland is that it is the largest of the salivary gland. So largest of the salivary gland. That is one feature, and the weight of the parotid gland is around 25 gram. So now we will discuss about the location of this gland, that is where this gland is actually located. So I will draw the diagram here. Okay. Now I am drawing some important bony parts here. So I am drawing what I am drawing here is the ramus of the mandible here. So I am drawing the ramus of the mandible here. So I am drawing here the zygomatic arch also. Here it is the external auditory meatus. I am drawing the external auditory meatus here. Now you have one muscle here. You have the mastoid here, and attached to the mastoid you have one important muscle here, that is the sternocleidomastoid muscle, which is going down. So it is going down like this. Now our parotid gland is located here. Now we have another muscle here, that is the masseter muscle, also located here. So that was a masseter muscle. Now I will be drawing the parotid gland. So the situation of the parotid gland is below the external acoustic meatus. So it is located below the external acoustic meatus, and it is located between the ramus of the mandible and the sternocleidomastoid muscle. So I will draw it like this. So the gland is located like this. So the gland is located between the sternocleidomastoid and the ramus of the mandible and below the external auditory meatus. And it is actually overlapping the ramus of the mandible and the sternocleidomastoid muscle, and also it is seen overlapping which muscle here. So there is one muscle here, that is the masseter muscle. So about the location of this gland, it is located between which all structure? That is ramus of mandible and sternocleidomastoid. And it is located below the, situated below the external acoustic meatus, EAM. Okay. So it is overlapping which all structures? Overlaps these structures, that is sternocleidomastoid, ramus of mandible, and also one muscle which it overlaps is the masseter muscle. So that is the feature of the parotid gland. It's the largest of the salivary glands. It is 25 gram in weight. So its location is between the ramus of the mandible and the sternocleidomastoid and below the external auditory meatus, and it is below the external acoustic meatus, and it is overlapping sternocleidomastoid, ramus of mandible, and also the masseter muscle. So, which structure is forming the capsule of the parotid gland? We should know that the investing layer of deep cervical fascia is forming the capsule of the parotid gland. So, it is formed by the investing layer of deep cervical fascia. So, how it is forming the capsule of this parotid gland? So, I will draw the parotid gland here. So, if this is the parotid gland, this is the investing layer of the deep cervical fascia. Actually, this fascia, it is splitting between the angle of the mandible and the mastoid process, and it splits and encloses the gland. So this investing layer of deep cervical fascia, it is splitting between the angle of the mandible and the mastoid process and encloses the gland. So after splitting, it will be forming a superficial lamina and also a deep lamina. So this is the superficial lamina. What I am drawing here is the superficial lamina, and this superficial lamina is attached to a structure that is the zygomatic arch. So what I am drawing here is the zygomatic arch. So this is the investing layer of deep cervical fascia. Investing layer of deep cervical fascia. So it is splitting between the angle of mandible and the mastoid process. It splits and forms a superficial lamina here. So this green color is the superficial lamina, and this superficial lamina is attached above to this zygomatic arch. Now, whereas the deep lamina you see here, it is very thin. Okay. So one thing I want to tell is that the superficial lamina is also known as the parotido-masseteric fascia. Masseteric fascia. This parotido-masseteric fascia is very thick. Okay, it is very thick and it is adherent to the gland. Thick and adherent. Whereas the deep lamina, it is thin. Okay, it is thin and it is attached to which structure? I will mention it now. It is attached to the styloid process. Here we are having the styloid process here. Styloid process, and also to the, here we have another structure. It is the tympanic plate, and also to the angle and posterior border of ramus of mandible. Angle and posterior border of ramus of mandible. So what I have drawn here, this much part is the deep lamina. So the deep lamina is attached to these three structures, that is to the styloid process, to the tympanic plate, and the angle and posterior border of ramus of mandible. Now between the styloid process and the mandible, a portion of the deep lamina, it is extending between the styloid process and the mandible. So this get thickened to form the stylomandibular ligament. So between the styloid process and mandible, there is a stylomandibular ligament, and this stylomandibular ligament is separating the parotid gland from the submandibular salivary gland, and this is being pierced by the external carotid artery. So it is the external carotid artery which is piercing the stylomandibular ligament. So the important thing which you have to know here is that the capsule of the parotid gland is formed by investing layer of deep cervical fascia, which is splitting into a superficial lamina and a deep lamina and enclosing the gland like a capsule. So the superficial lamina is very thick and adherent to the gland, and it is also known as parotidomasseteric fascia. Now, the deep lamina is thin and it is attached to the styloid process, tympanic plate and angle and posterior border of ramus of mandible. A part of the deep lamina extending between the styloid process and mandible is known as stylomandibular ligament, which separates the parotid gland from the submandibular salivary gland. And the stylomandibular ligament is pierced by the external carotid artery. So that is the important point here. Now we'll go into the external features of the parotid gland. So external features mean I want to um, emphasize the surfaces and borders of the gland here. So how many surfaces and borders for this gland? So actually it is located like this. Okay, so the gland is having an apex here. Sorry, okay, this is the apex of the gland, which is directed downwards. So one part is the apex, which is directed downwards. So this is the apex of the gland. Now if you look at this aspect, it has got a superior surface. So this surface is known as the superior surface. Superior surface. And it has got this surface which you can see from the outer aspect. This surface is known as the superficial surface. So this surface is known as the superficial surface. Now the surface that is the lateral surface which you can see from the outer aspect, that is known as the superficial surface. Now inner to that, that is on the medial aspect close to the pharynx. So you are able to see inside, you are able to see which part? That is the medial part, and the medial part is being divided by a medial border into, there is a pharyngeal ridge or a medial border which is dividing the medial part into an andromedial surface and a posteromedial surface. So posteromedial surface. Okay. So the medial part is divided by a medial border into andromedial and posteromedial surfaces. Okay. Now we have seen the surfaces. Which are the surfaces? It has got a superior surface, and laterally, which you can see from outside, is the superficial surface, and what you see on the medial aspect is a medial surface which is being divided by a medial border into anteromedial, posteromedial surface. Now about the borders, can you see here an anterior border which is separating the superficial surface from the andromedial surface. So this is the anterior border which is separating the superficial surface from the andromedial surface. And you can see a posterior border here which is separating the superficial surface from the posteromedial surface. And we have said that on the medial aspect there is a medial border which is separating the medial surface into andromedial surface and the posteromedial surfaces. So these are the surfaces, that is superior surface, superficial surface, andromedial surface and posteromedial surfaces. Now what about the borders? Borders are it has got three borders. How many surfaces? 1, 2, 3, 4. It has got 4 surfaces. Okay. And how many borders? 3 borders. Which are the 3 borders? One is the anterior border, and this anterior border is separating superficial surface from the andromedial surface, medial surface. And we have got a posterior border which is separating the superficial surface and the posteromedial surface. And we have got a medial border which is separating the andromedial and posteromedial separates anteromedial and posteromedial surfaces. So that is all about the external features. It has got an apex, 4 surfaces, 3 borders. Okay, now we'll discuss about the relations of each of these parts. So while discussing the relations of the parotid gland, we will discuss the relations of each part of this parotid gland. So first we will discuss the relations of the apex of the parotid gland, that is apex. So if you draw the parotid gland like this, so this is the apex of the parotid gland. It is overlapping a muscle. So overlapping which muscle? It is overlapping the posterior belly of digastric, like this. So it is related to, it is overlapping posterior belly of digastric. Now which all structures are passing near the apex? So we have two structures which are passing near the apex. So we know that the retromandibular vein is formed here. It is formed within the gland by the union of superficial temporal vein and the maxillary vein. Now the retromandibular vein, after forming within the gland, it passes downwards, and near the apex it is dividing into anterior division and also the posterior division. Now which all structures are located near the apex? One structure is the anterior and posterior division of retromandibular vein. It is related to the apex of the parotid gland, anterior and posterior division of retromandibular vein. So, and you have one important nerve here which is related here, that is the cervical branch of the facial nerve, which is located here. Cervical branch of the facial nerve. So after, so this is the cervical branch of the facial nerve which is located near the apex. So these are the two important structures which are related to the apex of the parotid gland. Okay. Now you have a superior surface also. Now you are having a superior surface. We'll draw the relation of the superior surface. So the relation of the superior surface is going to be discussed here. Now for that I am just drawing the diagram here. So what I am drawing here is the external acoustic meatus here. So I have the parotid gland here. So we can see the parotid gland here. So it is the superior surface, you can see here, it is related to the external acoustic meatus. That is the cartilaginous part of the external acoustic meatus here. So one relation is the cartilaginous part of external acoustic meatus. Another relation is here you are having, this is the superior surface, okay, and here you have the posterior surface of the temporomandibular joint. Posterior surface of TM joint, temporomandibular joint. Now you have to some vessels and nerve here. So which are the vessels and nerve here? So one vessel is the superficial temporal vessel. So you have the superficial temporal artery here. Now you have the superficial temporal vein here. Okay, and you have an important nerve here, that is the auriculotemporal nerve. So these are the neurovascular structures which are related to the superior surface of the parotid gland. So one is superficial temporal artery and vein, which is collectively called superficial temporal vessels, and the nerve here is the auriculotemporal nerve. So these are the relations of the superior surface. So superior surface is related to the cartilaginous part of external acoustic meatus and the posterior surface of the TM joint, and it is related to the superficial temporal vessels and the auriculotemporal nerve. So that is important. So I am now going to discuss about the superficial surface. So it is the largest of the four surfaces, and when you open the skin, superficial fascia and also the parotid fascia, you will be able to see the superficial surface like this. That is from the lateral aspect of the parotid. What you see from outside on the lateral aspect is the superficial surface, and it is the largest of all surfaces. So from this aspect of the face near the angle of the mandible, when you want to see the parotid, which all structures you want to open up, so that structures are related to a superficial surface. From superficial to deeper aspect, which are the structures located here? Think about that. Okay, these include the skin. Okay, first if you want to look into the superficial surface of the parotid, you want to open up which all structures? First is the skin. After the skin, you will reach the superficial fascia. Now in the superficial fascia, in this region you are able to see a muscle, posterior part of the platysma muscle and also the rhizorius muscle. So these muscles located superficially, and in this aspect you are able to see a cutaneous nerve, which is a branch of the cervical plexus. That is a great auricular nerve. So great auricular nerve is located here. So in the superficial fascia, in this region, you are able to see, that is in front of the ear. Okay, some lymph nodes here, as it is related to the ear, it is preauricular, as well as the superficial parotid lymph nodes are located in the superficial fascia here. So superficial parotid lymph nodes. So these are the structures. Now if you go further deep after the superficial fascia, we know that the investing layer of deep cervical fascia, it is splitting and enclosing the parotid gland and forming the capsule of the parotid gland. So when it split, what you see superficially is a superficial lamina. It's also known as parotid fascia. So the parotid fascia, it is actually the superficial lamina of the investing layer of deep cervical fascia. So parotid fascia, which is thick and adherent to the gland. So when you go deep further, a few deep parotid lymph nodes are embedded in the gland, deep parotid lymph nodes. So these are the relations of the superficial surface. So it is related to the skin, superficial fascia, some superficial muscles, posterior part of platysma rhizorius, great auricular nerve, preauricular lymph nodes, and superficial parotid lymph nodes. Further deeper, you see the parotid fascia and the parotid lymph nodes, which are embedded in the gland. Now you will see the relation of the anteromedial and posteromedial surfaces. Now we are going to discuss about the relations of the anteromedial surface and the posteromedial surface. So before that, I draw the diagram here. So you are having the parotid gland here. It is located below the external acoustic meatus, and you are having some muscle here. That is the masseter muscle here, and the gland is overlapping this ramus of mandible, and also part of sternocleidomastoid, and also the masseter muscle like this. Okay, so the gland is located like this. Now the anteromedial surface means what you are seeing from outside, this aspect is a superficial surface. On the medial aspect, that is on the inner aspect, you are able to see a medial surface which is being divided by the medial border into and anteromedial and posteromedial surface. So that is inside aspect I am drawing. There is a medial border which is separating the medial surface into, this is the anteromedial surface and this is the posteromedial surface. Now see the anteromedial surface. So it is related to which all structures? You can see the ramus of the mandible, posterior border of ramus of mandible, the masseter muscle, all are related to the anteromedial surface. So anteromedial surface, it is grooved by the posterior border of ramus of mandible and it is related to this, that is the masseter muscle, and also a joint. Here you are able to see the lateral aspect of temporomandibular joint, lateral surface of TM joint. So, and you can see the posterior border of ramus of mandible here, posterior border of ramus of mandible, and another muscle here, that is the medial pterygoid muscle, medial pterygoid muscle. And the emerging branches of the facial nerve are also related here. So the facial nerve, it passes into the gland from the posteromedial surface like this. So from the posteromedial surface it is entering the gland, and near the anteromedial surface it gives out some branches like this. Okay. So emerging branches of facial nerve, are also related here. So these are the relations of the anteromedial surface. Now on the posterior aspect, that is here you are able to see the posteromedial surface. Now you can see the posteromedial surface, it is related to, that is this surface is related to this bony landmark is the mastoid, and also it is related to the structures attached to the mastoid, that is the posterior belly of digastric and also the sternocleidomastoid muscle. So here also you are able to see the styloid process here, which is related to the posteromedial surface. So styloid process and the structures which are attached to it also holds its relations. Now there is also one structure which is passing into the gland through the surface, that is the external carotid artery. It is passing into the gland through the posteromedial surface. So two important structures which are passing into the gland through this surface, that is a posteromedial surface, are ECA, that is external carotid artery. Now the facial nerve also enters into the gland through the posteromedial surface. So these are the facial nerve, and the external carotid artery is entering the parotid gland through the posteromedial surface. So these are the two important relations. Now it is also related to a bony part, that is mastoid, and the structures attached to the mastoid include sternocleidomastoid, as well as posterior belly of digastric. Now also styloid process is also related here, styloid process and the structures associated with this, with the structures. Now important point is two important structures which are passing into the gland from the posteromedial surface are the external carotid artery and facial nerve. It is very important. Now you will go into the relations of the borders. So first we will see the anterior border. So this is the anterior border which is separating the superficial surface from the anteromedial surface. So relation of the anterior border will be discussed first. So what can you see on the anterior border? You are able to see a parotid duct here, which is emerging from the anterior border. So parotid duct is in relation to the anterior border, parotid duct. Now you have nerve here, that is some terminal branches of the facial nerve are emerging like here. Some terminal branches of the facial nerve are emerging here. So which are these branches? You can see the temporal branch. So this is a zygomatic branch of the facial nerve. There is an upper buccal, this is the upper buccal branch, this is the lower buccal branch. You can see the marginal mandibular branch, this is a cervical branch of the facial nerve. So these terminal branches of the facial nerve are emerging near this point. So terminal branches of facial nerve are related here. So which are these branches? Zygomatic, temporal, upper buccal, lower buccal, marginal mandibular and cervical facial nerve. Now you have some vessels and nerves which are related here. So you have the branch here. You know that the external carotid artery passes here. There is a branch here, that is the transverse facial artery and the transverse facial vein here. So two vessels which are related to the anterior border are transverse facial vessels. Facial vessels. Now in addition to that, near the parotid duct close to this border, you are having an accessory parotid gland here. Accessory parotid gland. Accessory parotid gland. Now you can see the posterior border here. This is the posterior border. Now the posterior border is separating the superficial surface from the posterior medial surface. Now it is overlapping which muscle? It is overlapping which muscle? Sternocleidomastoid muscle. So it is posterior border is related to the sternocleidomastoid. Now we have inside on the medial aspect, you are having the medial border. So this is the medial border, and the medial border, it is related to which structure? It is related to the lateral wall of the pharynx. Lateral wall of pharynx. So these are the relations of the borders. Now which are the structures within the parotid gland? Now we'll see the structures which are located near the parotid gland. So this is the parotid gland. The structure is located within the parotid gland. So we know that the external carotid artery which is passing into the gland from the posteromedial surface like this. Now the external carotid artery passes like this. Now the maxillary artery, it is leaving the gland, that is through its anteromedial surface. So this is maxillary artery which is leaving the gland through its anteromedial surface. Now we can see the superficial temporal artery here, which is located. This is superficial temporal artery. It is related to the superior surface like this. Now you are having the transverse facial artery here. Transverse facial artery. It is emerging at the anterior part of the superior surface. That is the transverse facial artery. So these are the arteries which are passing through within the parotid gland. This is external carotid artery. Now another thing is there is the posterior auricular artery also. Now this is the maxillary artery, and this is a transverse facial artery, and you are having the superficial temporal artery. Now if you see the vein, here, you know that the superficial temporal vein and the maxillary vein, they join together to form the retromandibular vein. So this again divides into an anterior posterior division near the apex of the gland. We are having another vein here, that is the transverse facial vein. So these are the veins which are located within the parotid gland. This is a superficial temporal vein, and you have the transverse facial vein. This is the maxillary vein. Actually, the superficial temporal and maxillary is joining to form the retromandibular vein, which is dividing into an anterior division and posterior division near the apex of the gland. Now we have a vein which is passing through the within the parotid gland, artery passing within the parotid gland. You have a nerve which is passing within the gland, that is the facial nerve. Okay. Now this is the gland. We know that the facial nerve is entering the gland from the posteromedial surface. Now it gives out some branches here. That is zygomatic branch, the temporal branch. Okay, you are having the parotid duct here. So there is an upper buccal branch, there is a lower buccal branch, marginal mandibular branch, and there is a cervical branch. So these are the different branches of the facial nerve. Now we know that the gland is composed of a large superficial and a smaller deeper part, which is connected by an isthmus around which the facial nerve is dividing. Actually, if you look at the gland, it is like this. It has got a large superficial part and a smaller deeper part which is connected by a portion which is known as the isthmus. So this is the larger superficial part. Now this is a smaller deep part. Now the facial nerve, it passes like this and divides around this isthmus. The superficial deep parts are connected by isthmus portion, and around this isthmus the facial nerve is dividing. So this is facial nerve. So this plane is known as the patellis faciovenous plane. This plane is the patellis faciovenous plane. So these are the structures which are passing within the parotid gland. So the blood supply of the gland is very easy. So we know that the external carotid artery is passing through the gland. Okay, it is supplied by the external carotid artery and its branches that arise within the gland. So ACA and its branches is supplying the gland. Now the veins are draining into the internal jugular vein and also the external jugular vein. So vein is to the internal jugular vein and external jugular vein. Now the nerve supply of the gland is important. Nerve supply, especially the parasympathetic supply. So it has got a parasympathetic supply. Now the parasympathetic nerves are secretomotor. You should know that it's a secretomotor. Now, so which is the pathway? Okay, the preganglionic fibers are actually beginning in the inferior salivatory nucleus. Now what happens? I will draw the picture here. So you have from the inferior salivatory nucleus, the preganglionic fibers are beginning. Then they pass into the glossopharyngeal nerve. So you have the glossopharyngeal nerve here. So this is the glossopharyngeal nerve. So from the glossopharyngeal nerve, they pass through this tympanic branch. The glossopharyngeal nerve has got a tympanic branch, so which forms a tympanic plexus over the promontory. So this is the tympanic branch of the glossopharyngeal nerve. So here you can see the tympanic plexus on the promontory. So they reach the tympanic plexus. So from the tympanic plexus, and then it goes into the lesser petrosal nerve. So this is the lesser petrosal nerve. So that nerve was a lesser petrosal nerve. So from the lesser petrosal nerve, it is relaying in which ganglion, that is the otic ganglion. It is relying in the otic ganglion. So this is the otic ganglion. Now you have one nerve here, that is the auriculotemporal. Here you get able to see the mandibular nerve through the foramen ovale. Now here you can see the auricular temporal nerve here. So this is the auricular temporal nerve. From the otic ganglion, what happens? It passes through the auricular temporal nerve. The postganglionic fibers after the otic ganglion, they pass through the auricular temporal nerve. So now that the auricular temporal nerve, it is supplying the parotid gland. So through the auricular temporal nerve, it is reaching the parotid gland. So postganglionic fibers from the otic ganglion pass through the auricular temporal nerve to reach the parotid gland. So what is the pathway? The preganglionic fibers are first beginning in the inferior salivatory nucleus. From the inferior salivatory nucleus, they pass into the glossopharyngeal nerve. So from the glossopharyngeal nerve, it passes into the tympanic branch of glossopharyngeal nerve, reaches the tympanic plexus. From there it reaches the lesser petrosal nerve and it relays in the otic ganglion. The postganglionic fibers from the otic ganglion pass through the auriculotemporal nerve and reaches the parotid gland. So these are secretomotor fibers. Now about the sympathetic supply. So the sympathetic supply, these are actually postganglionic and vasomotor. And these are derived from the plexus around the middle meningeal artery. Actually these fibers are starting from the lateral horn of T1 segment of the spinal cord and they are synapsing in the superior cervical ganglion. Postganglionic fibers are traveling along the branches of external carotid, maxillary artery and their branches. Okay. Now the sensory supply to the gland is coming from which nerve? That is, we have seen it is through the auriculotemporal nerve. Temporal nerve, it is giving out the sensory supply to the gland. So we have seen that, but the parotid fascia is innervated by sensory fibers of great auricular nerve. Auricular nerve, that is root value C2, C3. However, sensory supply to the gland is from the auricular temporal nerve. Now you will see the lymphatic drainage. So if this is the parotid gland, the lymphatic drainage is first to the parotid lymph nodes, and from the parotid lymph nodes it is draining into the upper deep cervical lymph node. Upper deep cervical lymph nodes. Now we will discuss about the parotid duct. Okay, that is the parotid duct. So we are going to discuss about the parotid duct, which is also known as the Stenson's duct. So I will be drawing the diagram. External acoustic meatus. So I am drawing the parotid here. So we are having an important muscle here. This was the masseter muscle. So masseter muscle is located here. So you can see that the parotid duct or Stenson's duct is a thick-walled duct and it is 5 centimeter in length. Thick-walled and 5 centimeter. So it is emerging from which border? It is emerging from the anterior border of the parotid gland. From the emerges from the middle of the anterior border of the parotid. Middle of anterior border of the parotid. So it is running forwards and slightly downwards. And which muscle it is running? This muscle is the masseter muscle. It runs on masseter muscle. So now the relations of this duct are superiorly. You are able to see there is an accessory parotid located here superior to this. So it is related superiorly to the accessory parotid gland. So, and we know that the transverse facial vessels are passing, that is transverse facial artery and transverse facial vein are passing above this parotid duct. So transverse facial vessels are related. That is superior relations. I am mentioning about the superior relations of the parotid duct. Okay, transverse facial vessels. Now which other structure? And now which is located here is above the, this is the upper buccal branch of the facial nerve. So superiorly to the parotid duct, upper buccal branch of facial nerve. Now downwards, that is inferior relation is inferiorly, it is related to which all structures? It is related to the lower buccal branch of the facial nerve. Branch of facial nerve. Now, so if you see the course of this parotid duct, we can see that it is running till the anterior border of the masseter. So after that it is turning medially and it pierces some structures. So which are the structures? So after reaching the anterior border of masseter, anterior border of masseter, so it is piercing some structure. So these structures are buccal pad of fat, the buccopharyngeal fascia, okay, and also the bassinator obliquely, bassinator muscle obliquely. Because of the oblique course of the duct through the bassinator, inflection of the duct is prevented during blowing. Okay, so it is important that it passes through the bassinator obliquely. Now the duct runs forwards for a short distance between the bassinator and the oral mucosa. And finally, the duct turns medially and it is opening into the vestibule. Opens into vestibule of the mouth. It is opening into the vestibule of the mouth opposite the crown of upper second molar tooth. Upper second molar tooth. That is very important. That is opening of the parotid duct or Stranding's duct. This opening into the vestibule of the mouth opposite the crown of upper second molar tooth. Upper second molar tooth. That is very important. So that is all about the parotid duct or the Stranding's duct. So that is all about the parotid gland anatomy. Thank you for watching this video. To see more videos on our channel, please subscribe the channel. Thank you.